We have been intelligently designed to have females to have babies. And with that being said, really the medical intervention sometimes oversteps, in my opinion.
Welcome to Wisdom Beyond the Womb. I'm Trisha Harris with Trisha Harris Photography, and today we are sitting down with Dr. Christie to go over the chiropractic care that is involved during pregnancy and for babies. Hi, Dr. Christie. How are you?
I'm doing well. How are you?
Good. Welcome. I'm glad you're here, and I'm excited to hear all about your services. Tell us about the name of your business and what you provide.
I'm Dr. Christie, like you said earlier, from Christie Chiropractic. We are a chiropractic office. We're in downtown Eau Gallie in Melbourne, Florida. We have a couple specializations, but our biggest one is in pediatrics and pregnancy. So we are Webster certified, which we can talk about in a moment, which is pregnancy, and then I am certified in pediatrics and pregnancy.
So chiropractic care is still very new to a lot of people. Some have never stepped foot in a chiropractic office. So how do you get the word out that it's safe during pregnancy?
Absolutely. So yes, there's even adults that have never seen a chiropractor before. And just to give you a short summary on chiropractic, so as chiropractors, we're looking for something called a subluxation, meaning that something is stuck in the spine or truly any joint. And our goal is to restore normal range of motion to that. There's the biomechanical aspect, meaning it's not moving the way that it should. That can be things that we feel. But there's also the nervous system aspect, which has to do with how that nervous system, the brain, communicates to the rest of the body. And that's where pregnancy, and especially pediatrics chiropractic, comes into play.
Okay. That is a lot to understand.
Yes.
Do moms, when they come to you, are they scared?
I would say
or
sometimes.
Are they referred?
So sometimes they are nervous, especially if they've never seen a chiropractor. It's a very gentle technique. It is a manual technique, and sometimes we do use our hands to adjust, but there are other ways to adjust. There's lots of techniques that do not involve any manual manipulation, where we can utilize a specific table or an instrument to adjust. So there's lots of levels in terms of force or non-force in order to get a proper adjustment that can be utilized.
So typically when you see pregnant moms, what are they coming to you for?
Sure. So we definitely see pregnant moms mostly for pain. I would say the majority of patients come in because they're feeling symptoms. So that's low back pain, hip pain, the change in the pelvis and the weight dynamics that happens as a pregnancy progresses, usually, or I shouldn't say usually, but can cause some symptoms in some patients.
Wonderful. You talked about something called the Webster method. Can you elaborate more on that?
Yes. So the Webster protocol or Webster technique, which you might hear it, is a pregnancy-specific technique. It does take education and additional education more so than we do in chiropractic school in order to be certified in this technique. We do change the way that we adjust a pregnant female versus the general population. And in some cases, it's not best for the mother or the baby to adjust the standard way. And so the Webster certification is a course that you take. You have to be tested out in order to be certified in order to do that protocol.
Now, is the Webster just good for moms already carrying a baby, or does this actually get the playing field adjusted as well for moms trying to get pregnant?
So actually both. So we can see patients that are pregnant that may be experiencing some symptoms with that pregnancy. The other thing that we can do is see patients who want to become pregnant. If you think of it like this, why get the body ready for pregnancy? Why get the body functioning the way that it should, the pelvis aligned and the sacrum aligned in the best position possible while you're pregnant? Don't you want to make sure that that's moving the way that it should so it's ready and prepared to hold a baby when you are pregnant?
Absolutely. Wonderful. That's good to know. You also mentioned that you take care of pediatric patients as well. So these are the tiniest. Do you have a standard process for this, like too young?
So actually, we can see a patient from day one. I generally tell patients that we want to see them within 2 weeks following birth. Scar tissue formation actually occurs within 2 weeks' time based on research, and so we want to adjust just to make sure there's not been any trauma or subluxation during the actual delivery. Our youngest patient, or my youngest patient, has been under 24 hours old. So that's been right out of the hospital. It's perfectly safe. We adjust differently for a pediatric patient than we do as an adult.
And what are the benefits of pediatrics being adjusted?
So this goes back to what the purpose of chiropractic care, looking a little bit deeper than just the tip of the iceberg, which is really that biomechanical, the pain care that we might see. So when you are adjusted, your afferent pathways communicate to the rest of your body better. Basically, your brain talks to your nervous system better, and those nerves go everywhere. And that includes the digestive system. So we see a lot of infants for colic, acid reflux, constipation. There's also sometimes some trauma or dystocia during birth, which is a failure to progress. When that occurs, you can have a torticollis, so a head tilt, plagiocephaly, where you have the cranial bones that are not quite as symmetrical as they are designed to be. And so we can also treat a baby for those things as well.
That's amazing. That's truly amazing that we can help them so young and early. Do you find the birthing process, whether it's vaginal or C-section, presents more of these issues?
So every birth is very unique. It's kind of hard to say if one can be impacted more so than the other. I will say that unfortunately in today's healthcare, we're rushed. We are rushing a natural process that's been occurring before any of us have existed, and that's unfortunate. Medical intervention, when medically necessary, is so important, and I'm very grateful to have those resources that we have today. However, it's a process that our body knows what to do. We have been intelligently designed to have females to have babies. And with that being said, really the medical intervention sometimes oversteps, in my opinion. So I do believe that depending on the birth, you can have a beautiful home birth, you can have a beautiful hospital birth, you can have a beautiful C-section where everything goes well. You can also have those three scenarios not go as easily as planned. And with that being said, the goal is to get out a healthy baby. And sometimes getting that baby out is not as easy or as desirable as it can happen.
So we all have a story, right? There's something that just stands out during our career that just carries us through. Tell me one of your stories of either a mom you've helped or a baby that you've helped, and it just really sticks with you.
One of my patients who had 2 previous C-sections and no chiropractic care was destined to have another C-section, and she wanted things to be different. There was some trauma, some medical bullying during her pregnancies, and so she just wanted to think outside the box. She did work with a midwife and a doula, actually, so she was supported as well. She did get ultrasounds regularly, so she was doing her due diligence to be a good mom, but she decided on a home birth, and not just for one baby, but for twins. So she had, of course, some, let's just say she was uncomfortable during her pregnancy, as you can imagine carrying 2 babies would be.
Right.
But I do believe with chiropractic care and the care that she got with massage therapy and having a support team behind her, she was able to have a successful home birth with twin babies. And that's after 2 C-sections.
That's amazing. Mm-hmm. That's truly amazing. Wow. A lot of times, because we don't experience something ourselves, maybe we don't know what it looks like, but what is the care process? Is it 1 visit, 2 visits? You create diverse plans for each individual patient when they see you?
Yes, so every care plan for every patient is different and unique. Everyone presents differently, and that's adults and children. We do a thorough examination. We allow for an hour for a thorough examination. In the pediatric population, we're checking for primitive reflexes, we're checking for tongue and lip tie, we're checking for a lot of other things that sometimes your primary care may not even be looking for. With that being said, depending on our exam findings, the care can be more wellness-based. If you're just coming in to get checked out, say we have a mom who was under care while she was pregnant, once a month is ideal for a wellness adjustment. If there are complications or things or concerns, we generally do see patients a little bit more frequently in the beginning of care. Our goal in general is to have patients not continue care at a heavy frequency. It's really more of a wellness-based protocol to, again, go back to making sure our nervous system is functioning the best that we can, and then we can be living our lives in optimal potential.
Thank you so much for sharing about your business today and the importance of chiropractic care. Is there anything else you want us to know?
Yes, that's a great question. So I do think, and I just want to share with not only yourself, but viewers who may be watching this video, how to find a Webster certified chiropractor or someone who specializes in pediatrics and pregnancy. So you can go to the International Chiropractic Pediatric Association website, and everyone who is Webster certified is listed. I think that that's so important to make sure that you find a provider that truly knows how to take care of a pregnant female, during this time in their and stage of their life. You can also find someone who specializes in pediatrics and pregnancy, like myself. I'm actually the only one in Brevard County fully certified on that same website, and that's www.icpa4kids.org.
Wonderful. Is chiropractic care covered under insurance providers?
So yes, most insurance companies will cover chiropractic care. In our office, we do a benefits check before the patient comes in to try to see what their benefits entail, what they offer for the patients. But yes, actually they do cover. We are in network with most insurance companies.
Wonderful. Thank you. What other services does your office provide?
So we are also certified chiropractic sports physicians. So we do also have training on on-field trauma, concussion protocol as well. So we actually, tying in the pediatric population, actually see a lot of young athletes in the area. We also offer more modalities than some other offices, including muscle stim. We have a class for laser. We have digital x-ray and some traction and exercises in-house as well.
Wonderful. You mentioned head trauma. If my child were to be a toddler age and bump his head, would that be something under that head trauma?
Absolutely. So yes, no matter the age, you can absolutely get a concussion from any head trauma. There actually doesn't have to be trauma to actually have a concussion. There can be enough impact, like a stop and go, that can actually cause a concussion, and there does not actually have to be any impact. So that's kind of a misnomer that people aren't aware of.
Wonderful. You also mentioned another service earlier about massage therapy coupled with the chiropractic care. Do you offer in-house massage therapy?
We do not offer in-house massage therapy. We do work with several massage therapists locally that we can refer to with.
Perfect. And if we want to get in touch with you directly, how do we find you? Are you on social media, web pages?
Yes, of course. We're on social media and web pages. So we, of course, are ChristieChiropractic.com. We're Instagram, Christie Chiropractic, and then, of course, Facebook, Christie Chiropractic as well.